Hi again, and welcome to our page. My name is Yvonne. I'm a pelvic health physical therapist here at His Therapy, located in Greer, South Carolina. And I wanted to bring you another instructional/educational video to piggyback off of last week's. So last week we talked about and reviewed the prenatal development of a baby within a female body and how it shifts the anatomy, and it can sometimes cause some pain and dysfunction. And so I gave you some strengthening exercises to try to avoid or mitigate any kind of pain or dysfunction and make sure that we have stability throughout the duration of our pregnancy. This week, however, I'd like to talk a little bit about stretching. We have to have the full range of motion for those muscles to lengthen and engage. If they can't lengthen all the way, a lot of times they're inhibited and can't strengthen and contract all the way, which can inhibit some of our stability and strength. Just as a disclaimer, and something I really want to mention and encourage, to always consult your local physical therapist prior to engaging in any exercise, especially while pregnant. If you do some of these exercises or stretches and they bring on pain, again, consult your physical therapist and they can help guide you in the right direction and modify and make it the most individualized plan just for you. All right, so without further ado, let's work on stretching those muscles. I myself this week am 27 weeks pregnant, so you'll be able to see a little bump there, and that way you can see how I modify some things. All right, let's get started. So let's come to a mat. I'm going to separate my knees way beyond hip distance for this. It's a version of happy baby, child's pose in yoga. So really separate those knees and walk your hands forward. Everything should be nice and slow. Again, this is relaxing and stretching. And then allow your body to come forward. In this position, we breathe and allow our bellies to be weighted down, but they're also supported by the close ground right in front of them, as well as the growing breast tissue. Again, it is close to the ground, so we're able to extend our upper back, which is constantly being pulled forward right now, with some support from the ground. If the full expression of that stretch is too much, you can always shorten your lever arms and bring the arms in, and I'll demonstrate. So we're going from an outstretched position to bending the arms in and resting the head on the wrist. Taking some nice deep breaths here. Allowing the chest to open, the upper back to extend, and the pelvis to also extend and lengthen. Okay, so that's child's pose. While we're on the ground, our hamstrings can also get very tight. Hamstrings are right behind the thigh. There are many modifications to do this. A lot of times if my patients have toddlers and they're already on the ground, this is a nice one for them to do while they're playing with their toddlers and just already in that position. So you bend one leg in and extend another one out, and you just crawl forward, and you imagine sticking your butt out. You should feel this stretch behind the thigh, not behind the knee, behind the thigh. If we feel it behind the knee, don't go as far. Okay, try to keep that knee extended or straight and stick out your bottom. And then crawl forward until you feel a stretch. And breathe here. We'll do 3 breaths to demonstrate. and then walk yourself back up. The adductors, which are on the inside of the thigh, can also become tight. So turning, keeping this extended leg where it is and opening up, separating the knees laterally. I already feel a nice stretch right of those adductors. So if we're here, now we're open, then we crawl forward. Again, stick your bottom out. You should feel a nice lengthening wherever those adductors are tight. For me, they're tight way up here, closer to the groin, but I also feel it right in the middle of the thigh. Take nice 3 deep breaths here. And walk yourself back up. Always making sure that you're supported while you're getting into these positions and out of these positions as to not shock any of those muscles that we are now lengthening and calming down. Finally, the last one is to open up that pelvic bowl, right? We have our pelvis, and then we have our muscles that lay right at the bottom of them. So we want to open up that space to allow the pelvic floor to relax. And this is really great, especially closer into that 3rd trimester as we prepare for a vaginal birth. So in this way, lock yourself back down or go into side lying and allow yourself to rest. Then roll onto your back. That way we can protect the low back from any kind of muscle strain. Then we bring both legs in. We tuck our bottom just a little bit. Bring our hands on the inside of the knee to not compress the knee joint. And we breathe here, allowing our legs to rest within our hands. Feeling that pelvic floor open and relax as we take 3 deep breaths. Come out of this position, again, bring those legs together, using your hands, rolling over to one side, and pushing yourself up. So that concludes our video on stretching. If you have any questions, feel free to reach out to us here at His Therapy. Thank you and have a great day.